Ossification. The sternum. The ossification centers are very variable in number, shape, position, and growth rate. Usually, there are single center in the manubrium and xiphoid with 3 or 4 centers in the body. Body centers for the manubrium and sternibrae appear from the above downwards from the 5th and 9th fetal months. Between 15 and 25 years of age, sterni fuse from below upwards. The xiphoid process fuse with the body at 40 years of age, and the body and manubrium fuse in old age, if at all. Rib. A bony center arises at the angle of the rib. In the 8th week of intrauterine life, that is fetal week, secondary centers occur at the head and at the tubercle at the 15 years of age and fuses at the 25 years of age. In case of upper limb, ossification of the scapula. The scapula ossifies in the 8th week of fetal life, and ossification center appears in the middle of the coracoid process in the first year of life and fuses at the 15 years of age. Secondary centers appear in the root of the coracoid process, the medial border and the inferior angle of the scapula between 14 and 20 years and fuse between 22 and 25 years of age. Ossification of the clavicle. The clavicle begins to ossify before any other bone in the body. It ossifies in the membrane from 2 centers that appear at the 5th and 6th fetal weeks and fuse in the 7th weeks. A secondary center appears at the external end at the 15 years in female and 17 years in male and fuses at the 25 years of age. The development of the elbow. Ossification center of the humerus and the elbow joint. The primary center for the humerus appears at the 8th week of fetal life. Secondary center appears in the head of the humerus at 1 and the greater tuberosity at 3 and lesser tuberosity at the 5 years of age. These fuse with one another at the 6 years and with the shaft at the 20 years of age. According to Rhines, at birth, distal humerus is composed of a single cartilaginous epiphysis separated from the metaphysis by an arched physis. Injury at this time results in complete epiphyseal separations. The primitive epiphysis differentiates into 4 ossification centers: 2 epiphyses, the capitula and the trochlea, and 2 apophysis. The medial and lateral epicondyles. Following such a division, subsequent injury is usually confined to the individual ossification centers. In contrast to the gross injury or displacement that occurs in the infancy, the cartilage of the proximal ulna develops a single ossification center, the Olecranon, which eventually leads to mineralization of the coronoid. The cartilage of the radial head develops into a further single ossification center. The appearance of the ossification centers occur 1 to 2 years earlier in girls than in boys and follows an orderly progression with appearance of the capitellar ossification center first at 1 to 2 years, the radial head at 3 to 6 years, the inner and medial epicondyle at the 4 years, and trochlea at 8 years, and Olecranon at 9, and the external epicondyle at 10 years. Secondary centers appear in the capitulum 1 year, that is 1 year, 2 year according to Rhines, radial head 5 years, 3 years. Internal epicondyle 5 years according to Rhine, 4 years, trochlea 10 years according to Rhine, 8 years, Olecranon 10 years, 9 years according to Rhine, 9 years, external epicondyle 10 years according to Rhine, 10 years, but here is given 11 years. 1, 3, 5, 7, 9, 11. Capitulum is 1. Capitulum is 1, radial head is 3, internal epicondyle is 5, trochlea is 7, Olecranon process is 9, external epicondyle is 11 years. 1, 3, 5, 7, 9, 11. These fuse at 17, 18 years of age and range in adolescence usually between the 10 to 12 years, and the three lateral ossification center fuse followed by the closure of their associated physis at 13 to 16 years. The medial epicondyle physis is last to close at between 16 and 18 years. Inappropriate treated injury to any of the ossification centers around the elbow may lead to deformity. However, the elbow physis contribute to only 20% of the final length. Shortening is often subtle. The ossification of the radius. The primary center of the radius appears in the 8th week of the life, fetal life, and secondary center appear distally in the first year and proximally at the 5 year of age. They fuse at the 20 years and 17 years respectively, and ossification of the ulna. The shaft of the ulna ossifies in the 8th week of fetal life. Secondary center appear in the distal ulna at 5 years or usually 6 years. In Olecranon at the 10 years or 9 years of the age, they fuse at the 20 and 17 years respectively. Ossification of the bones of the wrist, carpus, and hand. Distal phalanges appears at 9th week of the fetal life. Metacarpals 10th week of fetal life. Proximal phalanges 11th fetal week, that is 10th according to BD, 8, 9, 10 according to BD. Distal phalanges, metacarpals, then proximal phalanges 11, middle phalanges 12th fetal week, that is middle phalanx of the 5th digit 14th fetal week. Capitate 4, hamate 4, triquetral 3, triquetral 3 years, lunate 5 years, 4 to 5 years, 5 years, escapade 5 years, trapezium 6 year, trapezoid 7 year, pisiform 12 year. Metacarpal head except first and base of the first metacarpal. Metacarpal, all the metacarpals head except the first and the base of the first metacarpal, and proximal phalanges 2.5 years, a future 20 years, and base of middle and distal phalanges 3 years, and future at 20 years. Lower end of the radius 1 year, and future at 20 years. Lower end of the ulna 5 years, and future at the age of 20 years. Ossification of the metacarpal phalanges. These ossify between the 9th and 12th fetal weeks. Secondary ossification center appear in the distal end of the metacarpals of the fingers at 2 years and fuse at the 20 years of the age. Secondary centers of for the thumb, metacarpal, and for the phalanges are at their proximal end and appear between 2 and 3 years and fuse between 18 and 20 years of age. Lower limb ossification. Ossification of the pelvis, 3 primary, that is ilium, ischium, and pubis, and 5 secondary centers, that is Y-shaped piece, iliac crest, anterior inferior iliac spine, ischial tuberosity, and pubic symphysis. Ilium 8 week of intrauterine life, ischium 16 week of intrauterine life, pubis 20 week of intrauterine life. Ilium, ischium, pubis. By the 7th or 8th year, the inferior rami of the pubis and ischium are almost completely united by bone. About 13th or 14th year, the primary centers have extended their growth into the bottom of the acetabulum, and they are separated from each other by Y-shaped portion of the cartilage, which now presents the trace of ossification, often by 2 or more centers. One of the is the os acetabuli appears at the age of the 12 between the ilium and pubis, and feature with them at the age of 18. It forms the pubic part of the acetabulum. The ilium and ischium then become joined, and lastly the pubis and ischium through the intervening of this Y-shaped portion. At about the age of the puberty, ossification takes place in the each of the remaining portions, and they join with the rest of the bone between the 20 and 25 years. Separate centers are frequently found for the pubic, tubercle, and ischial spine, and for the crest and angle of this pubis. Ossification of the bones of the hip, shaft of the femur, seventh fetal week, head of the femur 4 to 6 months, according to Ryan 6 to 1 year, 6 months to 1 year. Greater trochanter 2 to 4, and according to Ryan 4 year, and lesser trochanter puberty, that is 8 year, according to Ryan. And these fuse at the age of the 18 to 20 years of age. A secondary center is present in the lower femur at which is a reliable indicator of full term fetus, that is according to Ryan, that is adductor tubercle. Ossification of the femur. The primary center is the shaft in the 7th week of life. A secondary center is present in the lower femur at birth. A secondary center is present in the lower femur at the birth, that is the reliable indicator that the fetus is full term, and another appears in the head between 6 months and 1 year of age. Secondary centers appear in the greater trochanter at the age of 4 and in the lesser trochanter at the age of 8 of age. All features at the 18 to 20 years of age. Ossification of the knee. Shaft of the tibia, 7th week of fetal life. Shaft of the femur and fibula, 8th week of the fetal life. Proximal tibia at birth fuses 20 year, and distal femur at birth and fuses at 20 year, and head of the fibula 4th year fuses 25 year. Patella 1 to 3 ossification center appear at 3 to 5 years. Fuse at puberty. Tibial tubercle 5 to 10 years, fuses 20th year. Ossification of the bones of the foot. Except for the calcaneus, the tarsal bones ossify from one center each. Talus and calcaneus 6th fetal month. Navicular 3 to 4 years. Navicular may ossify from many ossification center. Cuboid at birth. Lateral cuneiform 1 year. Middle cuneiform 3 year, and medial cuneiform 3 year. Metatarsal shaft 8 to 9. Metatarsal shaft 8 to 9th fetal week. Phalangeal shaft 10th week, and metatarsal epiphysis, that is 3 years. Base or proximal end of the first, and head or distal end of the other 4. Proximal and middle phalanges base 3 years and fuses by 7 to 20 years. Distal phalanges base 5 years and fuses by 7 to 20 years. Posterior epiphysis of the calcaneus 5th year, fuses at puberty. Ossification of the vertebra. Primary ossification center appears at the 8th week of the fetal life. One for body and one for each side of the neural arc. The C3 to L5 vertebra typically have the 3 primary ossification centers. Primary ossification centers appear first at the cervicothoracic junction at the 9th week in the uteri and are allowed by upper cervical, then thoracolumbar vertebra with the primary ossification center of the lumbar neural arches. The last two appear at approximately 14 weeks in utero. Primary ossification is finished by 1 year. A secondary ossification center, one for each transverse process, one for spinous process, one for upper and one for lower surface of the body. Radiopedia as ring or annular epiphysis at the upper and lower surface of the vertebral bodies. All appear at about 16 years and fuse by the 25 year. For the C3 to C5 vertebra, there are 5 secondary ossification centers at that appear at the puberty and fuse by the 25 to 30 years. At last 3 primary centers, one for each lateral mass and one for anterior arch. They unite at the 6 years of age. The anterior ossification center center appears at birth and visible by 1 year, and the arches appear at 7th fetal week and fuse with anterior arch at the 7th year. A neural arches fuse posteriorly by the 3rd year of life and fail to fuse posteriorly, resulting in the posterior spina bifida. Occasionally, there are 2 centers for the anterior arch that fuse at 8 years of age, and failure to fusion of these causes anterior spina bifida. Atlas has no secondary ossification center axis. 5 primary centers, one for the body, two for the neural arch, and two for the oriented process. Two centers of oriented process fuse in the midline by the 7th fetal life. Body fuses with oriented process and neural arches by the 3 to 6 years. Neural arches fuse posteriorly by 2 to 3 years. Two secondary centers, one for the tip of the oriented, one for the anterior rim of the body as its base and at its tip. Secondary center for the tip of the odontoid appears between 3 to 6 years and fused by 12 to 13 years. Radial axis has one secondary ossification center for tip of the dens. If it fails to fuse, a persistent ossiculum terminally is present. 7th, cervical vertebra, extra primary center for the attachment of each costal process. Lumbar vertebra have two extra secondary centers for the mammillary processes. Posterior neural arch fusion starts in the lumbar region at 1 to 2 years and proceeds cephalad to the cervical region up to 7 years of age. Fusion in the sacral region occurs last. Neural arch to the centrum fusion starts in the cervical region at 3 years and proceed caudate to the lumbar region by 6 years. Fusion in the sacral region again occurs last in the lumbosacral spine. Defects in the posterior of the neural arch give rise to spina bifida defect in the 5 to 10% of population. Sacrum, the body of each sacral vertebra is ossified from the primary center and two epiphyseal plates, one for its upper and another for its under surface. While each vertebral arch is ossified from two centers, the anterior portion of the lateral parts have 6 additional centers, 2 for each of the first 3 vertebrae. These represent the costal elements and make their appearance above and lateral to the anterior sacral foramina. On each lateral surface, 2 epiphyseal plates are developed, one for articular surface and another for the remaining part of the thin lateral edge of the bone. The periods of ossification about the 8th or 9th week of fetal life. Ossification of central part of the body of the first sacral vertebra commences and is rapidly followed by a deposit of the ossific matter in the second and third. Ossification does not commence in the bodies of the lower two segments until between the 5th and 8th month of fetal life. Between the 6th and 8th month of ossification of the vertebral arches takes place, and about the same time the costal centers for the lateral parts make their appearance. The junction of the vertebral arches with bodies take place in the lower vertebrae as early as the second year, but are not affected in the uppermost until the 5th or 6th year. About the 16th year, the epiphyseal plates from the upper and under surface of the bodies are formed. Between the 18th and 20th years, for the lateral surface make their appearances, the bodies of the sacral vertebrae are during early life separated from each other by intervening cartilage, but about the 18th year, the two lowest segments become united by the bone. The process of the bone union gradually extends upward with the result that between the 25th and 30th years of life all the segments are united. On examining a sagittal section of the sacrum, the situation of the intervertebral fibrocartilage are indicated by the series of oval cavities. Coccyx. The coccyx is ossified from 4 centers, one for each segment. The ossific nuclei make their appearance in the following order: in the first segment between the first and the 4th year, in the second between the 5th and the 10th year, in the third between 9th and 15th year, in the 14th in the fourth between the 14th and 20th year. As age advances, the segments unite with each other, and the union between the first and second segments being frequently delayed until the age of the 20 and 25 or 30. At a late period of life, especially in females, the coccyx often fused with the sacrum. Radiology poll: the odontoid process in the adulthood may remain separated from the axis by a cartilage disc and simulate an ununited fracture. Persistent epiphysis in the transverse of lumbar vertebrae are common and should not be mistaken for fracture line. Transverse segment and costal segment: thoracic, cervical, lumbar, and sacral. Thoracic forms the descriptive transverse process. Costal element forms the rib. Cervical fuses with the costal element and forms the medial part of the posterior wall of the foramen transversarum, anterior wall of the foramen transversarum, anterior tubercle costal transverse bar, posterior tubercle, and lateral part of the posterior wall of the foramen. Lumbar forms the accessory process, forms the real or descriptive transverse process. So sacral fuses with the costal element to form the posterior part of the lateral mass, forms the anterior part of the lateral mass in the costal element. Ring apophysis is a secondary ossification center of the vertebral in plate connected to the intervertebral disc. It is firmly attached to the disc fibrous annulus through sharp fibers, and its ossification occurs at 4 to 6 years of age. Its ossification occurs at 4 to 6 year old child. In the first year of life, the junction between the ring apophysis and the rest of the vertebral body is made through a cartilage layer that is only completely ossified around 18 years old, and that is the peak point.